Ferrets are popular, playful pets that seem to spend the majority of their time either expending endless energy or sleeping. The average lifespan is about 6 to 7 years, with a few living even longer. Most ferrets come from a single large commercial breeder and arrive in the pet store already spayed or neutered. A few owners purchase ferrets from private breeders instead. These ferrets tend to be bigger and sometimes a bit more aggressive. The owners of ferrets that come from breeders instead of commercial sources should know that intact male ferrets have a very strong, objectionable odor. Females that are not spayed have a very high risk of estrogen-related bone marrow toxicity and death due to anemia. This is why spaying and neutering have traditionally been very important. However, there is strong evidence spaying and neutering produces a number of hormonal changes that eventually lead to adrenal gland disease, a common and serious problem. Your exotic animal veterinarian can discuss some strategies to help manage both of these issues, both in intact pets and pets that have already been spayed and neutered. In the wild, the black-footed ferret eats whole prey. While some owners may want to explore feeding their ferrets this way, most prefer a formulated diet. Many generations of ferrets have been raised successfully on commercial formulated ferret diets. The most up-to-date information shows that the best ferret diets are made specifically for ferrets, are high in protein, and have as little plant-based ingredients like wheat, soy, and corn as possible, and no pea protein. While there are a lot of opinions on the best formulated diet to prevent such things as dental disease, GI disease, and maybe even cancer in ferrets, there isn't a lot of scientific evidence for any such claims. Some owners are considering raw diets. It should be kept in mind that even the best professionally produced frozen raw diets have been linked to bacterial contamination and illness and should be used with care. Treats for ferrets should be made of meat and not sugar, yogurt, or other ingredients. Ferrets can be housed in a variety of ways, from commercial ferret cages to dedicated rooms with a variety of hiding places and items to explore. As ferrets are very destructive, can wiggle through the smallest of places, and have a tendency to eat objects made of foam and rubber, they should never be allowed unsupervised in the house. Ferrets are generally very clean and will use a litter box. The larger the ferret's living space, the more litter boxes you will need. Choose a non-scented, paper-based litter. Ferrets enjoy toys and exploring. Toys should be sturdy and not contain rubber or foam parts. Tunnels can be made out of PVC pipe or other non-destructible plastic. Cardboard boxes can also be fun. Ferrets require yearly examinations and vaccines. Rabies vaccine is required by law in most states. Without the vaccine, a ferret that bites a human, even accidentally and in play, may be subject to quarantine or rabies testing. Canine distemper is almost always fatal in ferrets, and the vaccine should be given regularly. Reactions to vaccinations appears to be more common in ferrets than in dogs and cats. For this reason, expect your pet to stay for a while after vaccination, so the veterinary staff can watch for signs of a reaction and take steps in case one happens. For ferrets that have previously had a reaction, an individual vaccine strategy can be designed, for example, decreasing the frequency of some vaccines. While young ferrets are generally very healthy and playful, older ferrets are subject to an unusually high number of diseases, including some very common cancers. Many of these have treatments that can be very beneficial. Your ferret that is 3 years or older may want to consider twice-yearly checkups to help monitor for early signs of illness. With proper care and an escape-proof enclosure, ferrets can make wonderful pets.